Premature ejaculation. Definition: causes, what to do. The most common male sexual disorder ahead of erectile dysfunction, premature ejaculation affects almost 1 in 3 men during their lifetime, regardless of their age. How to learn to control your sexual desire. How to delay ejaculation. Advice from an expert sexologist. Definition: what is premature ejaculation? Premature ejaculation is a male sexual dysfunction. It is one of the most common sexual disorders since it affects 25 to 30% of men. Almost a third of them will present this difficulty at some point in their sexual life. Premature ejaculation is defined as a persistent or repeated ejaculation disorder during minimal sexual stimulation before, during, or just after penetration, and before the subject wishes to ejaculate. Other criteria for defining premature ejaculation include 2 most common clinical situations. That between 1 minute to 2 minutes of intravaginal penetration and the inability to delay ejaculation at almost all vaginal penetrations. Those which occur even earlier, the antiport is ejaculation which occurs before, or as soon as the penetration or a few seconds after. The man cannot control his excitement because the ejaculation occurs involuntarily. By ejaculating prematurely, a man cannot decide when to ejaculate. The man only complains of not having control or of having difficulty controlling the moment of ejaculation because he sometimes lets himself be overwhelmed by too many emotions. Risk factors and causes of premature ejaculation. Stress promotes premature ejaculation, which itself causes anxiety, which further aggravates premature ejaculation. Ejaculation can be of relational origin. Some men ejaculate prematurely with certain women only and show no abnormality with other partners. Age. Very common disorder in young adults. Anxiety disorders, e.g. anxiety and social phobia, hyperactivity syndrome, hyperthyroidism. A change of partner can promote an ejaculation disorder. Impacts and consequences. Premature ejaculation is a common disorder that causes various questions about the normal duration of sexual intercourse in men and confuses those who experience it. The man finds himself unable to delay ejaculation on all or almost all vaginal penetrations, with negative consequences on his self-esteem and his masculine identity, sometimes generating frustration, distress, and sometimes even avoidance of sexuality in a couple, explains Sébastien Garnero, psychologist, psychotherapist, sexologist in charge of teaching Univ Paris 5. Before continuing, the impact can also be significant on the emotional and sexual life of the couple, with sometimes, in return, a loss of desire of the woman for her partner. Solutions to delay ejaculation. Medication. Consult a sexologist. Premature ejaculation is not a disease but a sexual dysfunction. Strict medical management is therefore rarely indicated alone. On the other hand, consultation with a sexologist makes it possible to resolve this difficulty in most cases. The prescription of certain antidepressants of the class of serotonin reuptake inhibitors must be occasional and as a last intention, this one allowing to extend the duration of vaginal penetration, and the prescription of local anesthetics in the form of gel can sometimes be recommended, explains Sébastien Garnero. Motivation and patience are essential in an attempt to treat premature ejaculation disorder. Do not let the embarrassment settle, do not waste time, do not close in on yourself and consult a specialist. The consultation of a sex therapist can be an important help for the man suffering from premature ejaculation. It is often advisable to go to the consultation during the first appointment with your partner. Nevertheless, in practice, most often it is about individual requests emanating from the man who suffers from it in his affective and sexual life. Delaying ejaculation, exercises, techniques, drugs. Premature ejaculation is one of the most common sexual disorders since it affects almost 1 in 3 men during their lifetime, regardless of their age. We must not let this sexual dysfunction take hold. In most cases, a consultation with a sexologist can find a solution. Explanations with Dr. Antoine Fay, urologist sexologist. Handjobs and exercises. Rehabilitation exercises in sex therapy and readjustment in learning about sexuality can help men with premature ejaculation. The practice of specific stop-and-go type masturbation techniques can contribute to helping the man to regulate his psychic, sexual and bodily arousal. The application of an anesthetic cream on the glands can help delay ejaculation at first in order to regain Confidence in one's abilities. In all cases, an integrative approach in sex therapy is indicated by taking into account all the psychological, physiological and sexological factors. Sexual psychoeducation. Learning of pre-orgasmic sensations. Treatment. Better control of psychic and sexual arousal. Dedramatization of the symptom. Enrichment of sexual practices. Systemic factors interacting in the couple, concludes Sebastian Garnero. Antidepressants. It is necessary to realize that premature ejaculation can have multiple origins and individual and couple psychological consequences if not treated. Certain antidepressant drugs are sometimes prescribed in low doses, but they must be taken for very long months. A specific treatment such as duloxetine before sexual intercourse can be recommended, having a short-term delaying effect and makes it possible to mask the symptom, explains the specialist. Their effectiveness, often moderate, generally delaying the moment of ejaculation by a few minutes, can be observed after a few months of treatment. Tips to prevent premature ejaculation. Reduce the speed and rhythm of intercourse. Learn to breathe and use the penile pressure technique. Certain positions can delay ejaculation during intercourse, such as lying on your back, facing your partner. It is important to relax, make the foreplay last and let yourself be guided by your partner.